topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask Good Questions podcast, broadcasting live every Wednesday, 6 p.m. Eastern Time on W4CY Radio at W4CY.com. This week and every week, we will reach for a higher purpose in money and life, as well as a focus on health and wellness. Now, let's join your host, Bonita Bell Anderson, as together we start with Asking Good Questions.
Hey, welcome to the Ask Good Questions podcast. My name is Bonita Bell Anderson, and you may notice that I have a little bit different digs behind me in my office. I'm actually in my other office now in Washington State. So looking forward to a wonderful show today with a special guest, and we're going to be talking all about physical therapy. And actually, there's some really good questions we're going to ask today. So I would like to invite my guest, Dane Burningham, to the podcast proverbial stage.
Hi, Bonita.
And there he is. Hello. Thank you so much for joining us today.
Thanks for having me. How's Washington?
It is actually nice and warm. It's beautiful. I'm actually, in the summertime, we live on my daughter's farm. She's a vet. And it's in the Tri-Cities, which is close to the Columbia River. Yeah. And we had a baby horse. I should have brought a picture. We had a baby horse, a little filly that was born about 12 hours ago.
Oh, how fun.
Super, super cute. So, yeah, so we're on a farm up here in Washington State.
Awesome.
So let me tell everybody a little bit about you. Dane earned his undergraduate degree from the University of Utah. Now he is in St. George, Utah, which is how I got to know him because of being in St. George in the wintertime. He went on to earn his doctorate of physical therapy degree from Rocky Mountain University of Health Professions. Where is that?
Provo, Utah. So just about 40 minutes from Salt Lake. Yeah.
Okay. He specializes in treating pain from head to toe with a special interest in orthopedics, including shoulder and knee rehabilitation. Dane believes in focusing on each patient as an individual, treating their needs with a tailored plan designed to help best meet their specific needs. He utilizes a hands-on approach. He's seen through experience how powerful manual therapy can be in the recovery process. So what I really want to do today is talk about how we incorporate this into our everyday lives. Sure. Because I think that could be an interesting thing. When he's not in the clinic, he enjoys spending time with his family, and I did ask him about that. He does have 3 children and wife, Diana, a 12-year-old boy, a 9-year-old girl, and a 4-year-old boy, and plus he has a thriving physical therapy clinic. So they particularly love living in southern Utah, where they can spend time together outside all year long. He enjoys golf, tennis, drone flying.
Yeah. I
learned that about you. Yeah. And boating. And one of the things that I personally am so grateful for is I guess it's been about 2.5 years ago, I had a hip replaced. And I tell you what, my right leg wasn't working. It was like with all the manipulation that happened around that. And Dane's clinic was instrumental in helping me get back to walking normally and being able to go out and hike and all that stuff. So I will forever be grateful to them.
Thank you very much. We're happy to help.
Yeah. So tell me, Dane, let's start off and get rid of some of the common misconceptions that people have about physical therapy, and how do you think those misconceptions affect a decision to whether or not to seek treatment? What would you say?
Yeah, I think most of the time, at least from our perspective, the common misconceptions with physical therapy is the main thing is that I can only go there if I had a surgery or something like that, right? And so people think like I have to wait to be injured or something had to have happened to me, something major, in order to access a physical therapist, which that may have been the case in the past, but thankfully things are changing that now people have more access to physical therapy. And so I think that misconception kind of leads people to not getting kind of the musculoskeletal health care that they need because they're not sure how to access physical therapy in the first place.
Okay, well, great. I think today we're going to change that, right?
I hope so.
Yeah. So how does physical therapy help in managing chronic pain? So somebody that, I got to go do something. But what if you have chronic pain, and what do you feel should happen when somebody says, this has just been here forever? What would you say when they come in to see you?
Yeah, I mean, chronic pain is definitely the hardest to manage from any aspect, from the physical therapist aspect, from primary care doctors, from pain specialists. Because it's such an individualized thing when people have chronic pain. If somebody has a knee replacement or a hip replacement like yourself, Bonita, so that's pretty straightforward. Chronic pain becomes very individualized to each person. And so that can make treating it not as straightforward because there's not a set of rules that we can kind of follow. So chronic pain, when it comes to that, is we have to be very, very cognizant of each person. And when that person comes in to meet us, to really get a full understanding of what their history is, what got them to this point of having chronic pain. And there's a big story to that. It's not just one event. And there's a lot of psychology and personal history that goes into how everybody interprets pain. And so when somebody has experienced chronic pain over months and months or years and years, we have to treat the whole person and not just maybe their symptoms. Sometimes it's very easy to get caught up in just what their symptoms may be. And then we get too focused on what they're feeling and maybe not why they're feeling it or how it's literally changed their everyday life. Kind of, again, in society, in their family relationships, friendships, pain can really change a lot of things when it becomes chronic like that. So we need to really focus on the person and not so much the symptoms and how we got to that point.
Well, and the thing that is going through my mind is most health insurance has as a benefit physical therapy. I, for one, I don't think that I've really thought of it as just like an ongoing thing that I would go do. But especially for somebody with chronic pain, you would think that they would completely utilize that benefit, like 12 visits or something like that insurance will pay, because
sure.
What does insurance cover?
I mean, it really depends on insurances, private insurances versus government insurances, Medicare, Medicaid, VA, things like that. So it can really vary. So we really tell people I think another thing is most people don't know what their physical therapy will cover, right? And so I think people being a little bit more proactive about saying like, I'm having chronic pain issues, or I'm having these kind of things that are stopping me from being the best I can in whatever stage we're in life. And so kind of saying, hey, I should call my insurance and say, hey, like, what do you guys cover for physical therapy? A lot of them are very open to physical therapy because, in all honesty, physical therapy has a very high upside with a very low downside. We're not prescribing medications. We're not doing injections. Yeah. So there's very little risk to what we're doing. We're using the body's natural kind of healing system to get better. And so we're relatively cheap to an insurance compared to having a major surgery or going and having injections or paying for medicines. And so asking your insurance company, like, hey, if I go to physical therapy, what do you guys cover? Is there a copay? And how many visits do I get? We range from, some will give us 6 to 8 visits. Some will give us unlimited visits as long as we can show that the patient needs it. In the case of Medicare, there's not really a cap with visits for Medicare. As long as we can show that a patient needs physical therapy and they benefit from it, Medicare will continue to cover those services. So chronic pain, as we were just talking about, takes a lot longer to recover. I mean, it took us years to get there. It's not going to take us 6 visits to get over. So it's one of those things that insurances have gotten better at understanding the benefits of physical therapy, and they're more willing to engage and provide those benefits to their clients.
So that might be like the first action step from this episode would be call your insurance company and find out what you've got. Because by the end of this, I'm hoping we'll convince you to go, like, maybe make this part of your regular daily, monthly plan, is to have something done. So, like I was talking a little bit about my surgery and how crazy it was to have a leg that wasn't working after having a hip replaced. Can physical therapy be just as effective as surgery, do you think, in certain cases? Or can you think of any examples?
I think in the case of just specific like wear and tear, like osteoarthritis that maybe led to your hip replacement in the first place.
Yeah.
Therapy is not going to, change arthritis, right? We're not regrowing cartilage or anything like that, but we can definitely prevent or push off some of these major surgeries if we can change how the body mechanics are working. And so if we can get some tissues and some areas of the body muscles to work better, to alleviate some of the issues that are maybe happening with the bony anatomy, then we can change how people walk, how people move. And again, we can decrease pain and increase function without necessarily always going down the route of surgery. I think another misconception sometimes, as we kind of circle back to what you were saying, to your first question that you have, Bonita, was I think sometimes people will think, well, physical therapists are anti-surgery. And I'm not definitely anti-surgery myself. I'm pro-surgery, but I'm only pro-surgery when it's absolutely necessary to have a surgery. Sometimes, like perhaps in your case, it was time to have it and it needed to happen in order to have, the next 15
It's
or
been
20.
a great outcome now. Now I've got a great hip.
Yeah, and so sometimes it needs to happen in order to reach your highest level of function. Right. But there's a lot of times where we don't have to go down the route of surgery, and we can try these more conservative methods first in order to avoid these things that are more major. And every surgery has a risk, even if they go well. I mean, there's any risk with any surgery. And so I'm pro-surgery when it's time, but I'm also pro-exhaust all of your conservative options first before you feel like you have to go down that route.
Well, and so on another little rabbit trail here, what about physical therapy and injury prevention? Can a PT help someone avoid future injuries? Especially like, obviously I think about athletes, but most everybody, I think this would be a good thing to know for all of us.
Sure. I mean, any physical therapist is really uniquely trained in the musculoskeletal system. So understanding how the body works, body moves, which mechanics we need to work kind of together in the proper process. And so when it comes to being any athletics, any activity, things like that, to prevent or kind of minimize the risk of soft tissue injuries. I mean, athletic trainers are really, really good for that. Like that's what they're built for. Physical therapists are definitely in that world of saying, hey, we know how to build and strengthen the right areas in order to prevent future injuries. So again, most of the time people look at a physical therapist as I'm injured, then I go see them.
Right.
We're trying to really change the narrative, as you're saying, of talking about it, be like a physical therapist should be part of kind of your regular healthcare team to kind of keep you on the right track, prevent an injury so it doesn't become a bigger issue, down the line.
Right. Well, okay. So, talking a little bit more about like post-surgery recovery, somebody comes into you and they have had surgery. What would you say would be some key milestones to expect during, what are you looking to do? How would that rehab look if you have somebody, well, like in my, if you took a hip replacement and a leg that was just not working yet, what are some key milestones in a rehabilitation with that person?
Yeah, great question. So some of biology, we have to wait for biology, right? Tissues when you injure a tissue, damage a tissue, biology takes a certain amount of time for tissues to heal. If they're really, really torn, it can take 6 to 8 weeks for tissues to completely heal. If it's something slight or more minor, it can take 2 to 4 weeks for something to heal, like a mild ankle sprain, something like that, right? So first of all, understanding when the patient comes to see a physical therapist, that physical therapist understands where we are in the timeline of things. Is this a chronic thing? Is this an acute injury? Is this a post, surgery rehab? And look at it and say, all right, where are we in this timeline? So we have a better understanding of, all right, the tissues are, I don't know when we saw you, but typically hips are, a typical hip is 3 to 4 weeks after surgery. We see somebody.
It was about 3 to 4 weeks. And I had been, convalescing at home, but my leg was just not wanting to operate.
Yeah. So 3 to 4 weeks in, we're still kind of in that early phase of just letting the tissues heal. But hip replacements, they're really fast. Like you're up the next hour walking around,
they're walking
right?
around.
And so they're not kidding around when they do joint replacements. They're having you right at it because they want those tissues to load. That's how a hip is designed to be weight bearing. Those tissues, that's how they're designed to heal, is having weight bearing through them. And so again, knowing where somebody is in that process and saying, all right, we're 3 to 4 weeks out. The tissues are strong enough. They're healing. They're not fully healed, but they're strong enough. We're now at the phase where we need to help this person kind of improve their strength so that they can have better gait and better walking mechanics and mobility. In the case of a hip, like in your case, like you felt off because the mechanics were off. One muscle group was not working well enough. Yeah. Another was overworking. And so everything's not kind of fitting together. Yeah. So having the physical therapist evaluate the patient and kind of say like, well, this is what's working well. This is what's not working well. How do we kind of bring everything back into kind of the natural order of mechanics and healing? That's the secret thing for a physical therapist. That's where we're trained to do is anybody can give you exercises to do, right? We can go on YouTube after this and look up exercises for post-hip rehab. Right. The physical therapist is there in order to help you say, at this stage, where in the healing process, this is the things we should or shouldn't be doing. And with the evaluation, this is why you're different than Susie down the street who had a hip replacement at the same time as you.
Well, there's another aspect of this that I'm thinking about that a lot of times we might not think of, and that is, how can this support mental health? Are there psychological benefits to physical therapy that people may not realize? I know, before you answer that, I'm just thinking of my experience. I was frustrated.
Yeah.
Right. So what about mental health with PT?
100%. So pain affects us significantly. Loss of functions affects us significantly, right? It affects our emotional state, our psychological state, not just our physical state. When we can't do the things we've grown to love because our joints don't work, muscles are hurting, we're just in a state of pain and we can't feel like we can do the normal things. It's an emotional event, not just a physical event. Yeah. And so we work with, down here in Southern Utah, pickleball, being down in here is just a massive thing, right?
I'm not playing very much golf anymore, Dane, because I'm playing pickleball now.
It takes over everyone's lives down here. Like even if you don't want it to, your friends will at some point bring you into it. It cannot be avoided. Yeah. And so, we have some people who play 3 or 4 times a week. Like that's in their retirement age, that's their passion, that's their life. And so if all of a sudden, as somebody can't do that, that makes a massive difference in they can't hang out with their friends. They're not going out. They're not being social. They're not doing something with their spouse. They feel completely estranged from their normal life. And so that's what pain and loss of function can do for us. You're exactly right, Bonita. It's not just a physical health issue. It's a mental health issue when we're dealing with these things that change our quality of life.
Well, and thinking about Southern Utah, there's a lot of retired people. There's actually people that have come there from Florida, from California. There's a lot of people that love the high desert red rock country. What do you think the benefits? And so kind of expanding on this a little bit more, the benefits for older adults, and particularly in maintaining mobility and independence. Yeah.
So, ever since I graduated from school, I've only worked basically in retirement communities. Not what I chose. It just kind of, that's the way my life and career has played out. And I couldn't be more happy with how it played out, because this is a great group of people to work with. The active retired person who wants to like live their best life at the stage that they're at. They now have the time, the means, the ability to do those things that they couldn't do when they were working. And it's our job as a physical therapist to help them fulfill those things that they want to keep doing at this stage in life.
And just to let everybody know, his clinic is busy all the time.
Yeah.
It's a busy happening place every day. Dane, I have never been in there when it isn't like chatter, 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 and people doing all kinds of things. It's great.
And I think that, I mean, we foster that with the staff that we hire. So really, I would say anybody who's looking to go, physical therapy is not a fun experience as we're talking about, but when you go there, it should be an enjoyable experience. It should be someplace that as you go there, you experience some sense of fun with it, right? The staff should be fun. The other people around you should be fun. If you're going to have to do this, unsavory thing, find a place where you enjoy being and doing it. And don't be afraid if you go to a place where you don't enjoy to then go someplace else and find that place for your physical needs. You should it should be something that you look back on through a physical therapy journey and say, even though this was a lower point in my life, this was a moment I enjoyed because I met good people and I had fun doing it.
What about on the other end? What about PT with pediatric care? What about, I'm thinking about, like all the stuff that's in the news right now about the different things that are affecting children, like disability, developmental delays, musculoskeletal issues. What do you think about that with pediatric care?
I mean, it's obviously it's not the world I live in just based on my setting, but the physical therapy is massive for development, hitting developmental milestones in pediatrics. So we're actually currently working on trying to get a pediatrics specialist here in the St. George area. Hopefully we have that online in the next, year or so that strictly works with these kids that for whatever reason, it may be congenital, they were born with it, and maybe some accident that they had. But the earlier in life that we fix things or that we reach milestones, the better we achieve later in life. It's foundational, right, when we're young. And so if you happen to have a child, a grandchild, a friend that kind of you're aware of that you're noticing that something's just not right, please look into seeing a physical therapist. And if they're in your area, specifically a pediatrics one, because it's a niche that within physical therapy you can go and get further certified in is pediatrics. So finding somebody in your area that knows the developmental stages of where they need to be at 6 months, where they should be at 2 years, where they should be at 5 years, will be monumental in helping those kids' long-term future physically. I mean, we look at something like scoliosis, right? That a lot of times gets found younger in life.
Yeah.
I don't know if they still screen for that in elementary school. They definitely did when I was in elementary school. I guess I should ask my wife if they did it for my kids. I don't know. But that's something that if caught earlier, right, in adolescence can definitely be changed and avoid surgeries and long-term spinal and trunk issues if we're finding things early on.
Right. So back to more of your world. Now I'm thinking about another area is stroke. And what role does rehabilitation play in improving motor function?
A stroke is a major event, right? I mean, that there needs to be a good whole team working on anybody that's had, especially a major stroke, right? We're talking about speech therapy. We're probably talking about occupational therapy. We're talking about a team of neurologists. But we're definitely talking about a team of physical therapists too on the motor side of things. And so depending on the severity of stroke, we can go anywhere from, very minor loss to major loss of function, coordination, stability.
Yeah.
And so living in that world with physical therapy, it's really important, again, to find somebody who has experience with neurological patients. This is not strictly an orthopedic issue. It needs to be somebody that has a good understanding of when we have this neurological issue, this is a nervous issue, this is a communication issue from your brain, in finding how do we restore best as we can that type of level of function. It may be upper extremity where we're helping somebody the coordination to grab and hold things or to get dressed, right? Or It may be lower extremity, where a lot of times then it's fall prevention and balance and stability with that, because stroke is most likely to happen in an older population, not always, but tends higher. And so then they're at a higher risk for falls, which then leads to a higher risk of breaking something, which hospitalization. So stroke, any neurological rehab is really in the world of physical therapy, due to the balance, the coordination, things like that, where speech will help with that. Occupational therapy will help with them getting dressed and being able to feed themselves. Physical therapy will really help with their overall function of being able to maintain community activity, being able to get outside of the home and still have a higher quality of life.
Right. It's that whole activities of daily living that,
And that's really like almost everything we document in physical therapy is function based.
Yeah.
A lot of people think all we do is exercise. We do an exercise for a purpose in physical therapy. We don't have you, walk around or stand in the bars or go up and down steps in order just to make your knees or your hips or stronger or to have better balance. It's in order for you to be safe in your daily surroundings. And so physical therapy should be a functional based thing and not just an exercise based thing.
Right. So now turning to a little bit more, I'm thinking about equipment. I'm thinking about what are the latest trends, or are there advancements in PT technology? I guess you would call it. And could this possibly be helping patient outcomes?
100%. Great question. And so really in the world that we're starting to get into is to make your physical therapist more of a primary care provider. Somebody that you can go to at the very beginning. Is we need to up our game in order to have the ability to see somebody and know exactly what to do with them. And technology is definitely helping with that. And so just now we're starting a new cohort within our company of 30 new therapists that are going to be trained and specialized in using ultrasound to diagnose musculoskeletal injuries.
Oh, wow.
And so that's much cheaper than doing an MRI, right? So we can still get the same information, and then it'll help us have better outcomes because we're more specific in our treatments. And so this is something that there's only 200 within the entire country that are currently certified to do this musculoskeletal ultrasound. And our company is really looking to be the leader in that out west. And we're going to do 30 to 40 every year. So we hope within the next 5 years, we have another 200 to 300 therapists that are able to be better serving their communities based on the technology we now have to understand how the tissues are healing and how through physical therapy and exercises, we're changing how those tissues are responding.
Wow. That's exciting.
Yeah, it's really exciting.
We've got a fun future ahead.
Yeah.
So, so let's talk a little bit more about, you in your bio, you talked about how being holistic. How do you think PT fits into a holistic approach to health and wellness? I mean, I'm thinking about integrating that with other forms of treatment like nutrition or mental health care. How would you say, when you're talking about holistic, tell me what that means, as far as how does that work all together?
So the knee bone's connected to the hip bone, right? I mean, we can't ignore any one part of anything. We are not just a diagnosis. We are not just what somebody is seeing us for. We're a human, an individual with a lot of things going on. And so understanding that the best form of us takes several different people helping us to get there, and understanding that a physical therapist should be part of that team, as we're talking about, is when if we're trying to build strength, right? We have a surgery, we have atrophied over several months of not being as active. We have the surgery now, we have to recover from that. We understand you have to eat so much protein in order to gain muscle. So working with a dietitian or a nutritionist to understand like my body type, where I am, how much I weigh is going to help me know I need this much protein in order to start to regain muscle. We could do all the exercises in the world. If somebody's not eating well and kind of understanding this is what it takes to heal, it's going to take a really, really long time to get the strength back in these muscles that have been damaged that we need.
And I laughed because I laughed because right at where his clinic is in this Sun River area of St. George, there's a brand new Del Taco next door, and I think In-N-Out Burger is coming. Not the best nutritional choices, but
if we were to talk to a nutritionist, probably not something. That's not where they would tell us to go in order to start to feel better, right?
Yeah, just go next door. Yeah,
it'll make my lunches faster though, so that's
good.
But no, so really, I mean, having a good team, there should be anybody that wants to be health conscious needs to dabble in every single part of the healthcare world. Have a nutritionist, have a dietitian, have your primary care doctor, have an orthopedic, doctor that, if something major happens that you or your family is familiar with, that you feel comfortable going to. Have a physical therapist, have a chiropractor. I mean, if everybody is working within their lane of expertise in healthcare, the patient is best served. It's when somebody steps outside of their lane and says like I could never tell you the right supplements to take. Like, I don't know. Right. It's not my area of expertise. But if somebody comes in and asks about that, I sure better be able to say, hey, this is somebody that we need to talk to about that because this would benefit you. Yeah. So when we stay in our lane and do what we've been trained to do, and everybody kind of then can go there in that lane when they need it, it's the patient that benefits the most. And that's all that should really matter in healthcare is the patient should get better. It shouldn't matter who gets them better.
Well, thinking of I'm just thinking of some of the different things that are most prevalent out there. And the next thing I want to touch on is Parkinson's. I've got a client that is terribly affected by that. Just had dinner on Sunday with my son-in-law's dad, who has just been moved to an assisted living home, who, I'm just seeing Parkinson's way too much. Yeah. Can you explain the role of physical therapy in managing?
Sure.
That's basically a neurological condition, right?
Yeah. So yeah, it's a lack of dopamine, which helps us control movements. And so have you noticed what are the signs and symptoms that you've noticed in kind of those around you with Parkinson's?
They're shaking. They're shaking a lot. Being able to walk, just walk, becomes incredibly difficult.
Yeah.
And there's no, to me, there's no quality of life at all.
And those are the two big kind of telltale signs if somebody comes in with, tremors that are new, right? It's not an essential tremor that somebody's had for years, but some new change or development, some tremors. And then their gait changes, their walking changes. That's a huge thing that we can kind of help understand about diagnosing Parkinson's. And so
that's making me think, Dane, that if you're incorporating PT into a regular maintenance thing for yourself, then there is a potential that if you were seeing your PT on a regular basis, that maybe something might get caught early.
Right. And the earlier we catch things with Parkinson's, the better outcomes there are. And so exactly right. If you're seeing somebody on a semi-regular basis, right, they can see like, oh, this person, their gait has definitely changed from when I saw them 2 months ago, right? So, obviously we're not going to diagnose Parkinson's. They're going to do that on a higher, different level than us with some, testing, blood testing, right. Things like that. But we can definitely be the one that says like, hey, we need to talk to your primary care doctor because something's off, something's changed with you in the last, couple of months. So the really Parkinson's and physical therapy have long gone together for a long, long time. And we have several patients with Parkinson's at any one time that we're seeing. So the thing that we really see is with Parkinson's, the patient gets really small, like their movements get really short or small, and they get really fast but uncontrolled. That's why the tremors and the walking, their body tends to get ahead of their feet and they shuffle their feet, but they're kind of in this forward leaning posture. Yes. And so the rehab for Parkinson's is really well researched and really good. So the nice thing is there's been tons of research into Parkinson's and physical therapy, the high kind of correlation between positive outcomes with that. And there's a big study that talked about, it's called Big and Loud. So what we're trying to do is make really big movements again to get out of these small little short movements. So we really emphasize getting really big, like over exaggerating steps, reaching, walking. And then we really get the person to, because Parkinson's patients, you probably notice, get quiet, right? Their voice gets more timid, more mild.
Yes.
So we're trying to get them to project as well. And so Big and Loud is a really well-studied kind of avenue of Parkinson's treatment. There's other things like Tai Chi, again, because you do really big, well-controlled movements, is really good for Parkinson's patients. One of the most interesting ones is boxing. Parkinson's patients love boxing. Every single one that we have in here, we do some form of boxing with. There's something about that mental connection that, again, it lets them be big and throw power and do things, and get out of that small little box that Parkinson's is building for them.
Wow.
So boxing is a really, really cool thing that Parkinson's patients respond really, really well to as well.
Awesome. So what do you think? Let's say that again.
I said that's a really fun world as a physical therapist to work in, because it's very engaging and interacting, and it's very, very successful for the patients. It's rewarding for patient and therapist kind of combination, because they really can make a change or slow down the disease. And the patient or the therapist has a great time with these patients.
Yeah. Awesome. So let's change gears a little bit. What are some of the biggest challenges that physical therapists face? What do you think in your practice? How do you think you can overcome challenges to achieve the best outcomes? I'm just curious. I mean, I'm just like, this is a question that I'd like to hear what you have to say about what are the challenges that a PT has?
Sure. I think really our biggest challenge right now goes back to what we were talking about at the very beginning, is that people don't go to a physical therapist. Our biggest challenge is we've never been really good marketers of our skills and what we provide for people.
That's not your job.
No, it's not our job, but it should be our job. Like chiropractors over the years have been much better at marketing their services to the public than a physical therapist has. And so it's not a chiropractor's job to market, right? But they've figured out a better way to do it. Yeah. And physical therapy world, that's one of the things we need to get better at, and we're really trying to do. And a big part of it is advocating legislatively in our states in order to grant people direct access to a physical therapist via their insurance. One of the nice things with a chiropractor is their cash pay. A lot of times they don't go through their insurance. And somebody thinks, well, if I'm going to physical therapy, I'm not paying for that because my insurance should pay for it. And I agree, your insurance should pay for it. And so one of the things we need to do as physical therapists is better advocate for our patients through the legislative processes to get them the access they need through their insurance, that they can go to a physical therapist first, and we can be kind of their first point of contact within the healthcare profession to help find where they need to be. So
I can see a whole business for somebody.
Yeah,
you could have a whole business where you would hire somebody to do just that for them.
Oh, sure. Yeah. And so
Our biggest challenge, at least from my perspective, and the thing that I'm kind of most passionate about working on the business side of things right now, is making sure that everyone understands, like, you need a physical therapist in the same way you need a primary care physician, and look at the profession that way and say, like, all right, every 6 months to a year, I'm going to go have a physical with my physical therapist and say, all right, is there anything I need to work on? And so that's our biggest challenge, is integrating ourselves better into our patients' minds and into the healthcare system, and show the value that we do provide. Because I hope you found that there was a lot of value in your experience to physical therapy.
Well, it got me walking normally again.
Yeah, we need everybody to understand that same value that we do provide.
Yeah. You know, there's something that I learned a long time ago as I'm going into the business world, and that's something called USP. Do you know what USP is?
I don't.
It's unique selling position. So it's basically why. And so that's your challenge, Dane, is you need to answer that. why question. And I hopefully this is doing that today, but what is it that makes you unique, and why should people come to you, or why should they come to a PT wherever they are?
Yeah.
But I think that kind of leads into my next question, which is patient education. How do you teach patients to manage their conditions outside of therapy? I mean, you're sending them home with a set of exercises to do, but how else do you think that you teach patients to manage what, their own life? I think that patients are probably going to be your best referral for bringing more business in and getting more people to come in.
100%. So, I mean, the clinic that I'm at 7 years ago, we saw, 50 people a week. Now we see 50 people a day. And that's attributed mainly to the word of mouth that we've gotten through the community, which you're a part of down here, is we gave people good outcomes and a good experience. And so they wanted to tell their neighbors, hey, when you have a problem, go see these guys over at Mountainland. And so I think circling back to that patient education, that's as big a part of our job as a physical therapist as showing them the exercises. Again, anybody can find good exercises, right? As a physical therapist, our unique selling point is not that we have a special set of exercises that nobody has access to, right? But we understand the body, the musculoskeletal system of the body, better than anyone outside of an orthopedic doctor, in my opinion. And the research shows that when tested, physical therapists are right up there with anybody on understanding the musculoskeletal system. So educating patients on, like, when you have a musculoskeletal issue, we know how to treat that and how to kind of get you in the best position to recover from that. Patient education, if somebody comes to physical therapy 3 times a week for an hour, that's only 3 hours a week, right?
Yeah.
So really, that's not a lot in the grand scheme of things. So our job is to be good educators at the value that their physical therapy provides outside of the clinic, so that they understand, when I do this at home, I see the benefits of it and I understand why I'm engaging with it at home. One of the hardest things for us to do is to get patient engagement outside the clinic. And so one of the things that we're always pushing is, if we can educate them better on the why you're doing it, as you were talking about, like, what's the point of this? The point is not just to come to physical therapy. The point is you can go play pickleball again, or you can go golf with your friends, or you go on a hike in the mountains with your spouse, right? And so that's why we need you to do these exercises outside of physical therapy, because the big picture is we want to get you back to doing the things that you love to do.
Right. Well, I can't believe it. These sessions always go so fast.
It's been really fast.
Let's kind of wrap it up with this last question. How can our listener, our podcast viewer, how can they incorporate the principles of physical therapy into their daily routine to improve flexibility, strength, and overall well-being? What would you wrap up? How would you say around that to wrap up?
So, I want to say that I really liked how you talked about mental health. So the first thing I would say is your physical health is part of your mental health. And so staying physically healthy and active to the best of your ability will help you exponentially in all aspects of your life. And so looking at a physical therapist and saying, like, if you say I lack something in my life physically and I just can't figure out how to fix it on my own, that's when I think about a physical therapist. Find one in your area, Google them, ask a friend, ask a neighbor. There's a good chance that you didn't know that somebody in your circle of friends or your circle of life has been to a physical therapist and they just didn't talk about it, or you don't know it. So I would say, ask if you feel like you need help physically and that's what you feel like is holding you back. Ask about a physical therapist, because we're uniquely centered to help people improve the physical aspect of their life, which will then in turn positively affect all aspects of their life.
Right. So action step, everyone, go out and find out what kind of benefits you have and really consider incorporating physical therapy into your regular daily routine. So Dane, I so appreciate you being here with me. And you know what? This is called Ask Good Questions. And so I am hoping that this podcast has really engendered a few new questions that people can ask of themselves. And we called this episode Step into Wellness. And that's what I was like, I want people to make a step forward in how they take control of their own health and wellness. So thank you so much for joining me today. Any last comments, Dane?
No, I'd just like to say thank you very much. And again, thank you for, thinking of us and thinking of a physical therapist. And when you came to see us, you had good questions for us, and questions lead to answers. And so thank you for letting us kind of answer some of your questions back when you were a patient, and kind of giving me this opportunity again to.
Oh, well, I'm in there regularly. I now go in for massage because
yes, you do. Yeah.
That's another part of my routine is regular massage.
We appreciate your presence in the clinic regularly.
Thank you, Dane, and thank you for joining the Ask Good Questions podcast.
Thank you.
Today's episode is over, but we did ask good questions again, didn't we? Don't miss out as we broadcast live every Wednesday, 6 p.m. Eastern Time on W4CY Radio at W4CY.com. Join Bonita Bell Anderson next week for more conversations with experts on finances, retirement, behavioral finance issues, health and wellness, and more. Until then, remember to ask good questions.